Hi and welcome to #podblog. I'm Tom and this is Gareth, and today we're going to be talking about heel pain in children.
Severs is the most common cause of heel pain in growing children, also clinically known as
Calcaneal Apophysitis.
It normally comes in at the age of 8 to 14 in active children.
Yeah, so we see this in boys and girls between these, as Gareth said, the ages of 8 to 14. I most commonly see it amongst football and rugby players, and I think there's a lot to do with the sort of footwear that's involved with that.
Yeah.
But we'll touch on that in a little bit more detail later. So, Severs, are you seeing equal amounts in boys and girls at the moment?
Yeah, I think it's about a 50-50 split with sports changing now, and obviously activities. We're seeing a lot more girls playing rugby, hockey, and obviously with surfaces going more outdoors with these synthetic pitches, we're seeing a lot more load on these tissues. So I'd say it's about 50-50 at the moment.
Yeah, I think, for me, maybe 10 years ago it would have been predominantly sort of boys, but due to, as Gareth said, girls playing far more football and rugby as much as the boys now, we're seeing this more and more commonly with our younger females as well as males.
What is the normal complaint people come into the clinic with?
I think the first thing that we see is the youngsters complain of pain whilst they're playing sport, not necessarily during sport, but certainly after the half-time break, going into the second half, and very commonly post-training when they're getting out of mum or dad's car and they're walking into the house. We often find that they develop quite a substantial pain in their foot. Mum and dad might see them changing the way they walk, limping, as a result of the pain they're experiencing.
Anatomy-wise, Tom, what are we looking at?
So with Severs, we are looking at inflammation of the growth plate. This is only active during growth phases in life, which is why it's so common amongst the ages of 8 and 14. Essentially, it dissects the heel bone, and due to usually an increase in load, we get an inflammatory response within this growth plate, which then results in quite an uncomfortable experience for the child.
I think the most common things mum and dads come in and say, oh, we've been to the GP or we've spoken or looked online and it's a growing pain.
I think that they often say that, just stop what you're doing.
Rest is key. In my opinion, it's not. It's load management, so managing that child's activities. And it's working over a weekly timetable. We all know PE is twice a week. Well, I don't know, it used to be twice a week. We all know that training is on a Tuesday, Thursday and a Saturday. With after school clubs and activity and five-a-side at dinner times, we have to try and educate and manage that individual as much as possible. It's difficult, don't get me wrong. If someone were to hold back me in my younger days and say, Gareth, got a big game on Saturday, you can't play five-a-side with the boys.
I think you've got to be a little bit selective. I think it's a hard discussion to have with the child, but I think they need to prioritise in a case like this. Yeah. It's not a permanent thing, but it's something that just has to be in place in order for them to get through and focus on the sports that are most important to them. I think it brings us on to treatments quite nicely, actually. Yeah. So I think if we now look at how we manage and treat this condition, footwear can pose a bit of a problem, especially when using orthotic therapy. Most boots have a limited amount of space within them, and the boots are notoriously flat in their design, so you get very, very little difference between the front and back of the shoe, whereas most trainers may have a 10 to 12 mil drop. A boot has usually about 0. So I'm always pushing my youngsters towards boots that have more height. There's only one brand that I know, and that is the Asics range, and they've got the HG10mm written in a little bit of elevation, which gives us a 10mm difference from front to back of the shoe. Combining that with an insole, if the insole's got a lift added to it, gives us far more than just putting a lift inside a boot that's very, very flat. So I think for me, boot choice is really, really important.
We can take those characteristics and even look at a school shoe. I think obviously in history, it's very difficult to fit anything in a shoe like that, an old school leather plimsoll type of base like some schools are looking for. Obviously nowadays, schools are a little bit more forgiving with letters, and if we can go into a trainer base shoe, that helps dramatically. This isn't going to be forever. You can get good black
trainers now as well.
It's going to be just for a period. So I think schools are more forgiving with it, and the more room we have in the shoe, the more reduction of that stress we can pretty much get away with. I think the hot topic, which I'm going to pass off straight away because I don't want to get involved in this one, is stretching. What's your take on it then, Tom?
So mixed. if I'm being honest. There's conflicting evidence. When I've researched it, it seems to be all over the place at the minute. The way I approach it generally is I try and reduce load first with the likes of Footwear, Orthotic Therapy, activity modification. So again, prioritizing which is really important and which aren't. And then once we get that pain level down, introducing some simple stretching with our youngsters. Just trying to keep them compliant is probably the most difficult task, because the kids, they don't want to be doing stretching, they want to be out with their friends, playing on their iPads, Xbox, whatever it might be. So trying to build that in a fun way where they're actually going to comply with the exercises we put in place. But immediately my first goal, reduce pain, keep them active.
I'm probably on the fence a little bit with this. Some patients react really, really well to it. Some people find that extra stress actually aggravates the heel dramatically more. If I was going to implement it, maybe before activity, just so you're stimulating that tissue a little bit before you're going out to play sport. As much as, this is a very old school medicine approach, all the research uses ice as a symptom relief. Personally, I'm not a big fan of using ice. A lot of people come in, I've been icing this pain. I like to have contrast, so a bit of heat as well. But all the research papers push ice. I don't think there's anything wrong with using that as a symptom relief.
No. So yeah, in a nutshell, load management, footwear considerations, activity modification, orthotic therapy and gait analysis works really well, and then potentially a bit of stretching before sports, or when we get those symptoms down.